What does oral maxillofacial surgery means to you personally and professionals who might not know the full scope of oral maxillofacial surgery? Can you tell them what oral maxillofacial surgery is all about?
So, in short, if I have to express myself, I would say we are dealing comprehensively in reconstruction, rehabilitation, and regeneration of the face.
Sir, can you tell us about any case that has deeply impacted you or leave a mark on you?
I do remember a case of trauma for a child who was 14 to 15 years old.
And sir, as a teacher and a guide and a mentor, what advice would you give to your young resident and students?
So it requires a lot of skill, dedication, and passion.
Clear about some myths around the oral maxillofacial surgery that you encounter in daily practice. I welcome everybody to Santosh MedCast, a healthcare podcast initiative by Santosh deemed to be University. I am your host, Dr. Anoopam Bhardwaj, Associate Professor from the Department of Oral and Maxillofacial Surgery, and our guest, Dr. Amit B Lall, Head of the Department of Oral and Maxillofacial Surgery. So you have seen the masks, you have heard the drills, but have you ever heard the stories? So today we are going to host the podcast on the topic Welcome to Destroying Oral and Maxillofacial Surgery, Hear the Unheard. On the special episode, we are honored to speak with someone who has shaped not only the department but countless careers and lives. A mentor, a leader, and a pioneer. Our very own head of the department, Dr. Amit B Lall.
Thank you, Dr. Anupam.
Sir, thank you so much for joining us. So, sir, it's pleasure for us to be here. And now I am going to talk with you about oral and maxillofacial surgery.
Sure.
So, sir, what does oral maxillofacial surgery means to you personally and professionally?
See, Dr. Anupam, oral and maxillofacial surgery is a complicated word. It becomes sometimes difficult for people to pronounce. But personally speaking, it's a very noble profession. It's a passion, and or what should I say? It's more of a calling. So I would take it forward from the angle of passion and calling, which is deeply required for becoming a good oral and maxillofacial surgeon.
Very powerful word, sir. For our listeners, sir, who might not know the full scope of oral maxillofacial surgery, can you tell them what oral maxillofacial surgery is all about?
Okay, so that's a good question. I'll try to summarize what the profession actually means. Now, see, most of us, when we join dentistry, we join dentistry as a branch, probably as a second fiddle to medicine, right? So this branch actually serves as a bridge between medicine and dentistry. So people who are really interested in medicine, who join dentistry, I think it's a very well sorted branch which helps you to connect with medicine. And since we are dealing with the face, actually, the maxillofacial word actually means basically in and around the face, the maxilla and the mandible, the upper and the lower jaw. So since we're dealing with the face, it requires a lot of dedication, right? And a lot of basic instincts, because you're actually needing to restore the face after procedures which may be due to trauma, which may be due to trauma primarily because of road traffic accidents, interpersonal violence, sport injuries. Then you're dealing with situations of malignancies of the head and neck. You are reconstructing the upper and the lower jaw in situations. You're also dealing with cysts and tumors which are relatively benign. You are also looking for treatments with implants for missing portion of the jaws, which are patient-specific implants, dental implants, and so on and so forth. So in short, if I have to express myself, I would say we are dealing comprehensively in reconstruction, rehabilitation, and regeneration of the face.
It's a very nice and simple explanation of what does oral maxillofacial surgery mean. Sir, can you tell us about any case that has deeply impacted you or leave a mark on you in one way or the another?
That's a tough question because, see, as the face is in question, any surgeries on the face will leave a mark, will leave your mark on the patient and the patient's mark on you. So, at the end of it, you want to see a happy patient. But yes, to be very specific to what you've asked, I do remember a case of trauma, for a child who was 14 to 15 years old, and he was traveling in a car. He met with a road traffic accident, which left his jaw, both upper and the lower jaw, fractured. And he was brought to the hospital, to the Santosh hospital. And he had some facial lacerations. So comprehensively, he was dealt with. And the upper and the lower jaws were reconstructed. The orbit was reconstructed. And the scars were, sutured. And to see the patient smile again, to see the patient eat and chew properly again was a very gratifying experience. So sometimes, these incidences leave a very strong impression. And this is what these surgeries are all about. So they're very, very gratifying in person.
Okay, sir. That was a great experience for you, I think. And sir, as a teacher and a guide and a mentor, what advice would you give to your young resident and students?
What I would advocate is that the branch requires a lot of dedication and a fire within. You need a passion to pursue this branch avidly. Because, these surgeries around the face generally require long hours of dedication in the OT. You stand, you sometimes, have 6 to 8 hours of continuous OT. You are without food and water. So it requires a lot of skill, dedication, and passion. So what I would tell them is that you should join the branch because it is very gratifying. It gives you very good thrill. It gives you excitement. But then yes, it's a lot of hard work. So take this branch up. You can diversify. You have sub-specialization in the branch. But you take it up with good vigor and passion to move ahead.
To all the students out there, it's about calling.
Absolutely.
And sir, can you clear about some myths around the oral maxillofacial surgery that you encounter in daily practices?
That's very aptly asked. The general myths about oral and maxillofacial surgery generally is that we are, since it stems from dentistry, we are lucky it stems from dentistry because it helps us in a lot of ways. But since it stems from dentistry, people generally think that you are extracting teeth and you're doing some minor surgical procedures in and around the mouth. Right? So this is the biggest myth. Whereas the branch is a super specialty in itself. Right? It is a super specialty. It is dealing with congenital defects like cleft lip and cleft palate. It is dealing with trauma, facial trauma, right? It is dealing with cancer, treatment of cancer. It is dealing with reconstruction of facial defects and much, much more and beyond. right? It's dealing with orthodontic surgeries, where you'll be fascinated to understand and to know that your jaws can be positioned, repositioned into a desired shape, right? And it can make a drastic difference in the appearance of the profile of the individual. It can give you the necessary confidence, to move ahead. So this is the biggest myth, that it deals only with extraction of teeth.
Yes. Absolutely, sir. It's time people should understand the breadth of our work. Now, to make the podcast a little light, sir, there is a quick fire round.
Okay.
And let's switch gears and light segment. You should answer quickly.
Okay. So let me see if I can do justice to that.
Okay, sir. So my first question is, sir, favorite surgery to perform?
I think orbital reconstructions.
Okay. Most challenging moment in OT?
I think excessive bleeding from a post-ankylosing resection.
Yeah. One word that defines OMFS.
Challenging.
Favorite surgical instrument, sir?
Scalpel with a 15-number blade.
Your stress relief after a long surgery, sir?
I think I would just love to go for a long drive with a cup of coffee.
Okay, sir. Very nice answer, sir. You would have won an hamper in coffee.
I would look forward for an hamper anytime.
Okay. And now, sir, before we close, what final message would you like to leave our listeners with?
Yeah, I would tell them that they should know in depth. They should understand the need of the branch, and it's a very robust, challenging branch, and it's fascinating. It is extremely fascinating. It's a wonderful experience, though it is grilling, but it's a wonderful experience to get trained and use your surgical skills for the benefit of the mankind. Just to improve somebody's face leaves an indelible mark. It just leaves an indelible mark, and it is absolutely gratifying. So please come ahead and join this branch.
Sir, I would like to add just one thing, that face is the seat of expression, identity, and emotion.
Very true.
And
Very
sir,
true.
I would like to
So you're like a sculpture, who's working on the face and changing the dimensions of the face.
Absolutely, sir. Absolutely. So, sir, thank you for your insight, your stories, and your continued leadership. To our listener, thank you for turning into demystifying oral and maxillofacial surgery. I am your host, Dr. Anoopam Bhardwaj, signing off with one message: stay curious, stay compassionate, and never stop learning. Thank you. If you have any queries, you can ask in the comment section. And please do share our video, like, and subscribe.